people with depression usually will say, I'm depressed, clearly depressed, but also tired. People with sleep apnea will say, I'm tired. I'm maybe not as depressed, or maybe not very depressed, but like I'm primarily tired. But because we understand feeling tired, not motivated, not enjoying things as depression, then will come up as depression patients versus everyone versus thinking that they have sleep apnea.
Welcome to Whole by Design, the podcast exploring the human experience with compassion and curiosity. Together, we'll uncover powerful internal resources and tools to help you embrace clarity, joy, and your full potential because you are whole by design. Hi, everyone. My name is Dr. Julie Lopez, and I'm your host for Whole by Design. On this week's episode, we will be diving into the very fascinating, often hidden, invisible relationship between sleep apnea and mental health. I'm going to encourage you to stay until the end, where our guest is going to share the 3 primary ways that you can improve your sleep health today. I'd like to welcome Dr. Andres Barkil-Oteo of Washington Interventional Psychiatry, who is a trauma-informed psychiatrist who gets great results for his patients on improving their mental health and overall improving their lives. Before we jump in, don't forget to check out our website, www.vivapartnership.com, for free and low-cost resources that can change your life. Thank you so much for joining us, Andres.
Thanks for having me. I'm always excited to talk about sleep and sleep apnea and the importance of that for mental health.
I love that you picked this topic because obviously we all know that sleep is kind of a foundational element of well-being, but specifically how sleep apnea can be related to mental health, which has a lot of different facets to it. I think that's something that the average person isn't fully aware of.
Yes, and I've seen this a lot in my practice. So like few things, the idea that sleep relates to mental health, it tends to be kind of common knowledge. Everyone knows that if they don't sleep well, they don't feel well. The problem is it seems like people don't want to do anything about it, or they take it for granted that, okay, I'm not going to sleep because I have things to do, and then they feel not good. And then you try to kind of help them to improve their sleep, and that's when kind of the problems start. So I started trying to advise people about sleep and how they sleep, till with more questions that I realized, oh, some people I see have sleep apnea. And this is a close topic to mine because myself, I had sleep apnea 12 years, 15 years ago. And I went through the stages of how like I feel when people have sleep apnea. And then I got it treated and it's gone. And that made me much more attuned to the importance of sleep and sleep apnea regarding the mental health. So it kind of like I stumbled over this based on a personal experience. So
Let me jump in really quick because I think this is important. You said like you'll tell people and they'll realize, oh yeah, sleep's important. It's important for all elements of health, including mental health, but they may not realize that they actually have sleep apnea, that while they think they're sleeping and rejuvenating and recovering and resting from their day and setting themselves up for a great next day, they're actually not, right? They're sleeping, but they're not getting restorative sleep. Can you tell us a little bit about kind of that journey of discovering that, how someone could find out that they have sleep apnea, and then also what to do about it? Because it's like during an unconscious time, right?
okay, yeah. So usually people don't know that they have sleep apnea. They will just feel that they are tired during the day. Now, for just the basics of sleep apnea, basically, sleep apnea is what we are saying that people are stopping breathing during the night, briefly, so they don't wake up, but their brain wakes up. because the drop of oxygen. The brain is very sensitive to when you don't have oxygen because it consumes a lot of the oxygen that you breathe. So when there's a drop in the oxygen, the brain wakes up, but it doesn't wake you up. So you are in the state where your brain is up, but your body is down. You sleep 6 hours nonstop, but likely your brain is up more than half of the time. So your body is rested, your brain is not rested. And this happens just the technicality of it. We have something called obstructive sleep apnea. You have central and peripheral. The one more common is the one the peripheral, and basically it's the soft tissue around the throat collapses, so it closes the airflow, and that's when then people wake up. We see this a lot with classically people who snore. Sometimes, if you know someone who snore or you snore, the sometimes there is the experience where all of a sudden you can't breathe and you wake up, which tend to be kind of the more dramatic fashion. But people don't need to snore to have sleep apnea, which is this one of the kind of the main misconception. Because people say, "Well, I don't snore." That doesn't matter. You can still have a brief moment of apnea during the night. The other misconception is people think that only like people above BMI of 26 or 27 have sleep apnea. So we would see people who are, largely fit or thin, like there is no way I have sleep apnea. But there will, because only one category is obstructive sleep apnea because there is a lot of, say, like fat around the neck, the tissues are issue. Some people have sleep apnea because of just how anatomically their um, their palate relates to their jaw. So it's not something that they acquire; it's just something by design. They have a narrow angle where the air hits the throat, and that could create sleep apnea. So because of that, a lot of people don't think that they have sleep apnea. Now, some of the clear signs when people know if there's a problem is you ask them, okay, so you slept 7, 8 hours. Do you feel refreshed? Do you feel like you slept 6 hours, or do you feel like you haven't slept the whole night? And this tends to be a good indication. Now, some people will have insomnia because of anxiety, and that tend to it's normal, and it tends to manifest in difficulty falling to sleep, and then waking up around 3 a.m. And 3 a.m. is a pretty common time to wake up because usually that's when we are switching between sleep cycles. So, and then they are able to go back to sleep. With the sleep apnea, you don't have to wake up, but your brain is up the whole night. So you wake up in the morning feeling very tired, not motivated, like you haven't slept. And then you go about your day. There is the brain and the body manages because you have a cortisol peak happens around 4 or 5 a.m. to get you going. So the brain manages to go about another like 4 or 5 hours. That's when you start the day. You are tired, but you are functioning. And then we get to the lunchtime, and usually people after that they have a sharp decline in their energy, and this tends to be pretty typical for people with sleep apnea. If you only have regular insomnia, just like you didn't sleep well, usually you are tired throughout the day. You just don't feel like you have a lot of energy. The ones who their energy dips after lunch and they feel like they can almost have a nap if they can, sometimes is an indication of a sleep apnea. So, so that's from that part. Now, why this is important? Because first, if you can't sleep, you feel tired. Everyone experiences that. But with sleep apnea, because your brain didn't sleep, you feel all the symptoms that we think usually are depression symptoms. So you feel slow, you feel sluggish, you feel not motivated because your brain at that point is running on a very little reserve energy. So it only focuses on the main essential things to function. Everything else is out of the window. So you are tired, not motivated. And then because also like is disturbed sleep, physically you don't feel well. You feel fatigued. Now, there's something interesting about the brain with the relationship between the brain and the mind, like how the brain function and how we feel, and also with the body. So when the body is tired, fatigued, that usually brings the mood down with it. Now we know this relationship from depression. When people have depression, they have the mood component, and the body kind of follows. In this case, it's the opposite. So they are tired, and then they get depressed because everything just feels so heavy. And sometimes one of the signs is if people with depression usually will say, I'm depressed, clearly depressed, but also tired. People with sleep apnea will say, I'm tired. I'm maybe not as depressed, or maybe not very depressed, but like I'm primarily tired. But because it's we understand feeling tired, not motivated, not enjoying things as depression, they will come up as depression patients versus thinking that they have sleep apnea. So the relationship between the body, the physical energy, and the way we feel is intricate. And if one is not doing well, it will pull the other one with it. So good.
Can I jump in just for a second? So this is really interesting, right? Because you're a psychiatrist, so they come into your office and you probably have a questionnaire asking them all kinds of things about how they're doing on all these different levels. Have you had patients where they themselves have identified as having depression and you've seen their symptoms go away when you have really honed in on the potential that they have sleep apnea and that part is treated first?
So uh, yes, if I tell you like if I got $1 for every patient who was like this, I would have maybe $100.
That's a
Well,
lot.
I mean,
That's a lot
that's
of
a lot of
people.
dollars.
But I mean, words are powerful. Labels are powerful. People, read something. Oh my gosh, now we're in the world of AI, right? People, did you know this? This is just an interesting sidebar. Getting advisement for mental health is the fastest growing area of AI usage. So they're
I
asking questions like it used to be, hey, I'm just going to consult Dr. Google, right? And they might be like, all right, I've concluded I'm depressed, right? And then you go down a path. Like here are the top 5 treatments, and here's the way you do this, and here's the statistics about it. And in fact, our human system is pretty complicated, right? It's very easy for someone to go down the wrong path and then present in a certain way if they're not looking for the right.
Yeah, no, I've seen it. I mean, not to go on a tangent, but like I see it with my family and friends and patients. People are talking to AI for like advice, and because we know the CBT, online CBT, a lot of it could be like a CBT oriented. Now, on the downside of things, there was actually an interview with Tom Altman, and he was talking about how they had. I need to get the numbers right, but like they had like 70 cases of talking to AI, and then they end up committing suicide.
Yeah, it's a big lawsuit right now against.
Yes, so like there is a downside to it because the AI in the end is trained to optimize the interaction. So it will lead you through different pathways. Um, Maybe it will make your symptoms worse if you are, unless it has some guardrails about like what to feed information, what not. It's almost like the algorithm of Instagram, of YouTube, where they had this thing where uh, uh, teenagers with eating disorder will get more videos about uh, trying to be thin because it's just an algorithm that will optimize what you are watching, and they know what you like and they feed you more of it. So like technology could empower our good side or our bad side, depending. But
That's
yeah.
well, so I'm thinking about this very nuanced topic that you're sharing about, and it sounds like many people actually go down a very logical path that's actually incorrect because they're not asking the right questions or they're not looking for the right things. And especially because you're saying sleep apnea is a very hidden thing. I mean, you just shared a few myths that were debunked that I've heard many times. People thinking, if you're overweight, that can cause sleep apnea, or if you snore, that's what causes sleep apnea. And, you can just go down a path thinking, oh, that has nothing to do with me, or I wouldn't even think about that. I'm tired and I must be depressed, or I feel so heavy and I'm depressed. So,
Correct. And to be clear, so we have two groups. We have a larger group who tend to have sleep apnea and depression, so two separate entities, and we have a smaller group who tend to have largely sleep apnea. Now, I've seen many in each group, but of course, I've seen more people who had actual depression and sleep apnea. I've seen few who had just sleep apnea, and we treated them, and then all of a sudden is like, oh my god, they still have maybe a little bit of symptoms, but they don't qualify for like a clinical threshold anymore. Now, to focus on the more common case, which tend to be people presenting with depression, they have a separate depression diagnosis and they have sleep apnea they didn't know about, and these tend to be the the treatment-resistant depression cases. We are at Washington Interventional Psychiatry. We are a kind of a tertiary outpatient care. We get a lot of consultation on patients who their depression is not getting better because we do also ketamine and TMS. So sometimes I see these cases and I'm like, okay, well, let's talk about your sleep. That would be important. And then you realize they actually have sleep apnea. And then you treat the sleep apnea, then they feel much better. They still on the same meds. It's not like you're gonna take them. Maybe like you do reduce some of the meds, but I'm not saying that we're gonna cure your depression with curing the sleep apnea, but it will make it much more
treatable?
mal.
Well, let's say treatable, right? Because you're saying it was treatment-resistant depression. And
Correct.
if it's a question,
It'll
how
make it treatable.
to
It
become
will
more
become
treatable?
depression that you could treat.
Yeah, amazing.
Because
It's huge, actually.
yes, and I tell people like it it doesn't matter what I give you. Like you cannot outrun sleep apnea because basically your brain is not getting enough oxygen, so it's up. And then if it's up, then there is nothing we can do it during the day to be more productive or like to be less depressed. The other presentation people come in a lot is they think they have ADHD, and then you talk to them. Many of them will have depression, and a subset will have depression because they have sleep apnea and they can't sleep. Because one of the more common sleep apnea symptoms during the day is brain fog. They can't focus. And yeah, of course you can focus if you are tired. So then you help them with their sleep apnea, and all of a sudden it's not like they become super performer, but they just become, like me and you, where we are tired sometimes, but we still function in a non-optimized way, but that's fine. So that tend to be also like another presentation for sleep apnea.
Yeah, it becomes so important to have this on the radar before you start going down another area. And I think it's actually a pretty huge shift to go from treatment-resistant depression, recognizing there's some sleep apnea, to depression that is treatable, right? Treatment-resistant depression feels just as hopeless as depression itself might feel, right? There's no point. What's the point? I can't even do anything about this. It's kind of a similar.
Correct. It's like a terminal illness where you cannot get over it. Versus, I'm not saying to be clear, every treatment depression case is sleep
Right, right,
apnea,
right.
but screening for sleep apnea is so easy and the treatment is so straightforward that even like nowadays, even on a suspicion that there is sleep apnea, I just tell people get the test, and if it's negative, then move on with your life.
Right.
But if there is something here, then we actually hit something very important that we need to address.
Yes. And just to review, you said if someone might be curious whether or not they have sleep apnea, one of the signs is that they'd get really tired after lunch. Is that right?
So it's a combination of waking up in the morning feeling already tired, feeling like they haven't slept. Then fatigue, brain fog, just down during the day, and then they do crash in the afternoon. Now, not many people have the luxury of being able to take a nap, but it's almost if you are able to, you will take 20-minute nap.
Yeah.
Um, and that usually, that doesn't have to be after lunch, but any time in the afternoon because your brain is already running out of steam.
Right. And then, well, this is super empowering, I think, is just being more sophisticated around our understanding of mood and what we might be experiencing, and especially the sleep apnea piece. So let's say, someone's like, oh my gosh, I do wake up tired and my mood feels low. And then I definitely want a nap after lunch. And maybe I related to you what you said about the brain fog. Like I noticed that I have that. Where would they go to get a test for sleep apnea? Could they ask any doctor to do it? Do you recommend a particular place?
Okay, so this has been honestly, I think, the issue why sleep apnea has been so um, underappreciated because the way to see if you have sleep apnea is to do a sleep study. And sleep study traditionally will be done in the hospital, and then they came up with this device that you could take home and you sleep while having the device on you, and that will record it, and you have to return it to the hospital. Now, because these devices are expensive, they didn't have many of them. So we always had a chronic problem with getting people access to sleep studies. The wait 3 to 4 months, unless you are lucky, you have access to a sleep center that's way more efficient. But my personal experience, and then many people who I used to send for sleep studies, that it takes time. And because it takes time and people are not convinced that I need to do it, then people don't do it. Unless you are the ones who can't stay up during the day and then they crash when they are driving home, then, like it becomes
So
the
severe.
priority. But a lot of people is like, I'm not gonna bother.
Mhm.
So recently, they one company created a basically disposable device. It's all from like it's a pretty cheap plastic kind of thing that you use only once. And the idea is instead of having to have an expensive device that then you have to rent basically because you stand with the patients, we have a disposable device that they just give to anyone who wants to do the sleep study. So there is only one device in the market now. It's sold by different websites, but the device is called Watch Pat One.
Watch at one.
Uh, Watch Pat.
Watch pad.
Watch PAT.
Watch pat.
Yes. Watch Pat One.
Okay.
So that's a new device. No financial affiliation. I have nothing to do with the company. But I haven't seen any other device, so this is why that's the one. And it seems many websites now sell this exact device, so it doesn't matter who the vendor, you're always gonna selling the same thing. So basically, you sign up with the business model of like how to treat sleep apnea is they sell you the device with because for device you need a medical order to get the sleep
Uh-huh.
study. So then that's a problem because then you have to find a sleep specialist. So basically, these companies sell you the device and the sleep consultation at the same time.
Got it.
So you go to the website, you basically buy the device, and with that, you get a sleep consultation. So you speak with a sleep specialist who asks you the questions of, like tired, motivated, and all that. And then they will recommend the sleep study for you. And then they send the device by mail. That arrives a couple of days later. It's pretty self-explanatory. It's like a smartwatch with oxygen sensor and then a heart monitor rhythm that you put here. And then you connect it to an app. You sleep one night, and this is it.
That's
The
it. That's amazing.
the information go through the app to the company, and the device is basically one-time use, recyclable. So like you basically you throw it away or you send it back to them. And the whole thing can be done in a week versus it used to be you have,
Months, right?
yes. And then the copays and then insurance won't pay for the study and all this nonsense. Now it's the device, they run sometimes, like promotions, but I think it's like around $160. And
Mhm.
that includes the device, the sleep consultation, and the report.
That's amazing. Gosh, such a difference. So, what a great thing to rule out, right? To if you suspect, and you gave us some ideas of how to test for that and really change the trajectory of how you might be looking at your depression or looking at your brain fog or looking at your ADHD or whatever it's been classified as, because there's so much that gets missed if you're not checking for the sleep apnea piece, if I'm understanding you correctly,
No,
potentially.
correct. And the of course we don't test everyone. We only test the ones who have high yield for the sleep apnea, which tend to be, feeling tired, non motivated, and crashing in the afternoon. But the ones once they they have the positive signs, it tend to be high probability that they will have sleep apnea. Now, for that, we have degrees with the sleep apnea. So we have the mild, moderate, and severe. There's an index that reflects how many times you stop breathing per hour, and also how low your oxygen blood level goes down. Based on that, there's a number, and the problem is, and it used to be the problem, and still the problem. Um, the money is really not from the device. The money tends to be from the CPAP machines. So there is a tendency sometimes, not with everyone, but the moment you have some kind of sleep apnea, they serve you a CPAP machine, and of course it works, but it's an overkill and it's annoying, and people have to wear it. So not everyone should be on a CPAP machine. Only the ones who are, more like moderate to
Severe.
severe.
Yeah.
The mild to moderate, the mild could be not treated and it's fine. Many of us have mild sleep apnea. It doesn't bother us that much. But usually I tell people if it's mild and you already have symptoms, so if your numbers are mild, but you have the fatigue and you have the inability to sleep, then you need treatment. The main treatment is if it's not CPAP, something called the um, 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 jaw advancement device. So it's a night guard, top and bottom, and the night guard basically pushes your jaw out. So it creates some space in the back because we say the apnea is when your throat tissue collapses,
Right.
so you can't sleep. So that pushes your jaw out, so it creates a space in the back for you be able to sleep.
Oh my gosh, I'm learning so much. I want to do it all. And I could talk to you forever, but we're at that time where we have to shift gears. So I'm going to prompt you for what we promised at the beginning, which is the 3 ways to improve sleep right now that you recommend.
So prioritize sleep. It's very important for
Oh,
health and mental health. Uh, Second, and this is a common thing that's a problem. People work till they drop, basically. So try not to do any work 2 hours before going to bed. You're gonna feel tired, and you're gonna be not productive the next day. So you're gonna be a cycle. So you'd rather just get some break before you go to sleep.
so
Third,
off the screens, stopping
yeah,
2 hours ahead of sleep time.
correct. Now, if you want to see your phone, it's fine, but like try not to doom scroll before going to sleep. This is not good for your sleep or anxiety. Third is there's a lot of supplements that could be helpful for sleep for people who are having a kind of mild issues with sleep. Magnesium is a big one. Melatonin, we know. Combination of these. There's plenty of supplements in the market. Just kind of try something that helps. But sleep is important. If you have constant issues with sleep, combined with what we talked about, the fatigue, then consult with your doctor if you could have sleep apnea.
Thank you so much, Andres, for all your wisdom with us today. Those 3 things again are number one, prioritizing sleep. Just you already know intellectually, sleep is super important. take the actions to actually make it a priority. Number two, stopping work and screens 2 hours before bedtime. And number three was, let's just see, what
The supplements before
supplements.
you start getting medication, because some people end up supplementing with a glass of wine and or two, which is not very wise. But I tell people if you want to drink wine for enjoyment, it's fine, but like don't drink it because you want to go to sleep. There is a safe supplements like magnesium and melatonin that could be very effective.
So great. Thank you so much for joining us on this episode of Whole by Design. And thank you to our audience as well. I hope it left you feeling inspired to toss out the labels, embrace new perspectives, and take one step closer to the joy and clarity you deserve. As always, visit www.vivapartnership.com to access our free and low-cost resources that will empower you and your loved ones on health and healing. Let's spread the message, subscribe, review, or share this episode with someone who could benefit from a stigma-dropping approach to mental health today.